Hi, class. It's Colleen. Today we're going to be talking about chemotherapy. We've already talked about the different types of cancers that patients can have and how the cells are very fast at reproducing itself. So we need to find ways in order to stop this progression of the cancer throughout the body and or to completely get rid of the cancer. So we're going to talk about chemotherapy. So the objectives for this session are to state three reasons why chemotherapy would be administered, define chemotherapy terms, and I know it seems like there's a lot: adjuvant, neoadjuvant, induction, consolidation, maintenance, first-line chemotherapy, second-line chemotherapy, and palliative. We also want to explain how chemotherapy works on the cells, and I want you to be able to list 3 chemotherapy types. So what is chemotherapy used for? Is to cure cancer, control tumor growth, shrink tumors prior to surgeries or radiation, relieve of symptoms, such as palliative. And I put a little picture over there. You could see the cancerous cells. What happens is different chemotherapy will either stop cell division, they'll actually interfere with the DNA, the RNA, and it causes spontaneous cell death, and it creates the cell death. And it destroys microscopic cancer cells. So here's some of the chemotherapy terms that you will hear. Adjuvant, this is used to destroy leftover cancer cells. That is like if a patient had surgery, for example, breast cancer, and they had a mastectomy, but they're still concerned that there were still cancer cells floating around, they'd receive adjuvant chemotherapy. There's also neoadjuvant chemotherapy. This administered prior to surgery. For instance, if a patient had a big tumor, they want to shrink that tumor so they don't have to cut through so much. There's also induction, and this is to induce a remission. Consolidation, this is administered once remission is achieved. That way they can continue remission. And maintenance, this is to help prolong remission. So the adjuvant and neoadjuvant are mainly used for patients with solid tumors, and induction, consolidation, and maintenance are really for the blood cancer, such as leukemia, lymphoma. There's also the first line. This is considered the standard therapy. This is the chemotherapy that is evidence-based, that has worked the best for patients. Second line is, just say the patients do relapse with the first line, they will use a second line chemotherapy. And then there's palliative, and this is administered for symptom management. How does chemotherapy work on the cell? Chemotherapy targets the cells in different phases of the cell cycle to allow for cell death and or damage. So these cells are fastly multiplying. So sometimes they're going to need different types of chemotherapies to kill the cancer cells. Unfortunately, with chemotherapy, all cells are compromised. So these patients become immunocompromised. Their red cells will go down, which will cause some symptoms of shortness of breath, heart palpitations. They may need blood transfusions. Their platelets can be lowered, which means there's an increased chance of bleeding. So there's a lot of education and teaching that needs to go on for these patients. So there are different types of agents, as I was stating before. Sometimes we'd have to use multiple chemo agents to actually kill the cell. So the first one is alkylating agents. This chemotherapy keeps the cell from reproducing by damaging the DNA. So this is to treat lung, breast, and ovary, as well as leukemia, lymphoma, Hodgkin's disease, multiple myeloma, and sarcoma. In rare cases, this type of chemotherapy can lead to leukemia due to the effects of the bone marrow. Because, as I stated earlier, a lot of the chemos can affect all cells, and this can affect the cells in the bone marrow, which can lead to leukemia. The chances of this are small, but there is still a chance of that happening. Then there's the nitroserous. This type of chemotherapy is able to go to the brain. So patients with brain tumors, we would need to use this. So it goes through the brain barrier, through the blood, and is able to go to the brain. Anti-metabolites, this stops the DNA from copying itself. It acts as a substitute for building of the cells by blocking the RNA and DNA. This prevents the cell from reproducing. These are used to treat leukemias, breast cancer, ovarian cancer, intestinal tract, as well as other cancers. Then we have the anti-tumor antibiotics, anthracyclines. These can affect the heart. Before treating the patient, they usually will have to get an echo to make sure that their heart's okay, their left ventricular function. And then you also have to keep track of how much of the drug they've received, because there's a certain limit, because you don't want to hurt their heart. They change the DNA inside the cancer cells to keep it from growing. They bind with the DNA so it cannot copy itself and the cell cannot reproduce. These are used for several cancers. As I stated, you need to be really careful with these chemotherapies because it can affect the heart. Topoisomerase inhibitors, I'm terrible at pronouncing, I apologize. These are plant alkaloids. They interfere with the enzyme. They separate the strands of DNA so they cannot be copied. There are different types of the topoisomerase inhibitors. There's a 1 and a 2. Mitotic inhibitors, these are plant alkaloids as also. They stop the cells from dividing into new cells. They can cause nerve damage. There's 2 kinds. There's the taxanes and vinca alkaloids. These can cause what's called peripheral neuropathy. This can affect the hands, the feet, numbness, pain, burning. It also can cause temperature changes, for instance, being the cold. They can be, if they're a little cold out, their hands can feel freezing, or their feet. So it's very important to monitor these patients for any peripheral neuropathy while they're receiving these. Then there's the corticosteroids. These are steroids. They're natural hormone and hormone-like drugs. Examples of these are prednisone, methylprednisone, and Decadron. These can actually help with the cancer itself, but they're also used at times to prevent nausea. And there's the reference, the American Cancer Society. I hope this has helped, and there's some also readings I have for you to follow up on. Any questions, please give me a call. You have my number, and I hope that helps.